Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, chair of medicine at the University of Louisville, and we had a wonderful grand round speaker this morning, Dr. Furman in our Department of Medicine in the section of Geriatric Medicine, and she's been with the Trager Institute of Aging, and she actually spent a year on Capitol Hill, and she did a fellowship in health policy, and she gave a talk this morning summarizing her experience, health and aging policy from Washington, D.C. Dr. Furman, can you summarize your talk in 60 seconds?
Yes. Thank you so much for that introduction. So I was working in Senator Elizabeth Warren's office, and I was working on her health policy team and her oversight team. And I was able to focus on nursing home and hospice issues. And so I just want to summarize what I learned, because I think this is what all physicians could really do, is advocacy. And we need more physicians in Washington, D.C., because policy is made through legislation, but also rulemaking. And so I learned that you always want to start with what's best for the patient, because there is enough money to figure this out, and we can change policies and we can change laws to really help our patients. And policy change is easier through the rulemaking part than through the legislation part. And also, congressional offices really do read our papers. And so if we can do policy papers, if we can write about what's important to us, then we can get change made in Washington, D.C. And also, this health and aging policy fellowship, you can be a doctor, a nurse, social worker. So I'd encourage everybody to really do a fellowship like this, because that's how we're going to change this policy, is people that really know the issues. And also reach out to your senators, your local senators, your congressmen, your state, because a lot of policy is even state policy. And if they have a relationship with a physician, then they'll call you and they'll ask you, what do you think about this? And we can move legislation forward, and we can move policy forward. So it takes a village, it takes a lot of people to get this done, but change is possible. It's over time, but it does change. And so I'd encourage everybody to get involved and do advocacy work.
Well, fantastic. Thank you very much. It's one of our pillars in the Department of Medicine is advocacy, that we should all get involved so that we can determine what our future is going to be. Thank you so much for this insightful Grand Rounds. And this has been a Cardinal Minute.